Hello everyone, my name is Janelle Brown, and thanks for tuning into my video on nursing delegation for my class in Nurse 430 Leading and Managing for Innovation. Hope you enjoy. What is delegation? Delegation is a process of transferring authority and responsibility to another team member to complete a task while retaining accountability. A licensed nurse is responsible for providing clear directions when a task is initially delegated. Registered nurse may delegate tasks to another registered nurse, practical nurse, and assisted personnel. However, the RN must be knowledgeable of the Nurse Practice Act and regulation regarding the use of practical nurse and assisted personnel within that state. Practical nurse may delegate tasks to other practical nurse and assisted personnel. Delegation factors and task factors. Nurses can only delegate tasks appropriate for the skill and education level of the healthcare team member who is receiving the assignment. Task factors. Prior to delegating a task, the registered nurse wants to consider the following. Predictability of outcome. The nurse may want to know if will the completion of the task have a predictable outcome? Is this a routine treatment or is this a new treatment? Potential for harm. Is there a chance that there is going to be a negative outcome of assigning this task to this particular team member? Complexity of care. Does this task require the team member to provide a critical critical thinking or assessment during completing this care? Need for problem solving and innovation. Level of interaction with the client. It is imperative that the delegatee, which is the registered nurse, consider the following prior to delegating the task to the other team member that is receiving the task. Prior to delegating a task, the registered nurse wants to ensure that the person who is accepting or receiving the task has the education, training, and experience to complete the required task. For example, a registered nurse is asking another registered nurse to insert an NG tube. It is important that that registered nurse who is receiving the task have the experience and the training to insert the NG tube. However, it is expected that all registered nurses have the experience from clinicals or SIMS lab during the school to insert an NG tube. However, is that registered nurse experienced? So the nurse who is delegating the task must ensure that the nurse who is receiving the task is experienced to complete the task. By experience, it is expected that the personnel who is receiving the task have the knowledge and skill to perform the task. It would not be a proper delegation if the registered nurse assigned another registered nurse with no experience on inserting the NG tube to complete the task. It is important for that registered nurse who is receiving the task to demonstrate competency. And of course, making sure that the personnel receiving the task follow agency policies and procedures and the licensing legislations. It is important for nurses to use nursing judgment knowledge related to the scope of practice and delegatees' skill level when delegating. It is also important for nurses to use the 5 rights of delegation. The right task. What task can the nurse delegate? A nurse would not ask assistant personnel to administer a nebulizing treatment to a patient with pneumonia. However, it would be a right delegation if the nurse delegate the task to an assistant personnel to assist a client on the bedpan who has pneumonia. Right circumstance. Under what circumstance can a registered nurse or a practical nurse delegate a task? A registered nurse wouldn't delegate a task to an assistant personnel to measure the vital signs of a patient who is post-operative and is taking Narcan for respiratory depressant, to reverse a respiratory depressant. However, a registered nurse or a practical nurse can delegate the task to an assistant personnel to measure the vital signs of a post-operative client who is stable. So the most important part of a right circumstance is whether or not the patient is stable. Right person. To whom can you delegate the task to? You wouldn't delegate a task to an assistant personnel to administer the enteral feeding to a client who has an head injury. However, you can delegate the task to a practical nurse to administer enteral feeding to a client with head injury. It is important to have good communication when delegating a task. For a good example of right delegation and communication is delegating a task to an assistant personnel to assist Mr. Brown in room 312 with a shower before 9 a.m. You inform the assistant personnel where to go, what time to go there, and when you would like that task to be completed. Right supervision and evaluation. Supervisor or the registered nurse may oversee the other team member in completing the task and also provide feedback after or during the completion of the task to inform task how they are doing, is the task being completed appropriately, what can be done to make sure that the patient's safety is at the forefront, and to improve the skills. Thank you for watching my video, guys. All the content of this video was provided by ATI Nursing Education, Content Master Series Review Module, Nursing Leadership and Management Edition 7.0. Thanks for watching.